Welcome, everybody. Thank you, everybody who is here and joining me today on another one of our wellness webinars. This is one of those free monthly topics that I share every month. We've been doing this for, gosh, probably close to 4 years now. And so this month, February, is Heart Health Awareness Month. And we thought, what a great idea to focus on something related to the heart. The last time we did was a few years ago where we talked about cholesterol. So now we're coming back and we're talking about what is known as hypertension or high blood pressure. And what we hope some of the takeaways are for you in today's discussion is being able to identify some risks and understanding what the warning signs may or may not be, and then explaining a little bit more about managing the signs and the symptoms or the condition if you are officially diagnosed with that, strategies to move forward, and also to share some resources with you if there's anything else that you need outside of this webinar. So if we've never met before, hello, my name is Dina D'Alessandro. I am a registered dietitian, also known as a nutritionist. I work in a variety of different fields, and you can kind of see everything on screen that I do. And I'm very, very happy because with me today are a lot of my students. So it always makes me feel warm and fuzzy when I get people like that, in addition to registrants that I don't know or complete strangers on the internet. So everybody is welcome here. So thank you so much for joining. Some housekeeping things, as you probably heard as you were entering into the session, it is recorded because, as I said, some people register for it but can't make the event live. So I share the recording with everyone who has submitted their email addresses to me. And then in about a couple of months, this goes live for public viewing on the DishWithDina TV YouTube channel. So there's a wide library of topics there, and I'll share a little bit more about that at the end. You can use the chat box at any time. I always try to end a little bit early so we can have some Q&A. It doesn't matter if the topic that you want to ask about is related to this. If I have the time to answer it, I will. But that said, as I always like to say, I am a dietitian, not your dietitian. So please make sure that you are just receiving this information as it's meant to be, educational and informational, not as medical advice. Please make sure that you are speaking with your own healthcare providers. And then just to wrap back around, as I said to you before, we're going to, because you send your emails when you register, they automatically go into my distribution list, and you will get a follow-up email with a survey so you can tell us how we did, if there's anything else you want to learn about going forward, the link to the recording of this, and then you'll be put on the mailing list going forward. And right now I'm only sending out like a monthly newsletter. I try really hard to not inundate people too much with their inboxes, but you can always opt out if you want to. And moving forward, we're going to start first. I always like to share a little bit about like the anatomy of things. So what is even blood pressure? What does that mean? Well, the heart of our body supplies our organs and tissues with blood. And the way that that does is through a different bunch of mechanisms here, as you can see on screen. The circulatory system is involved. As the blood moves around the body, it puts pressure on the walls of the vessels. And so that is what the blood pressure is. And we'll see coming soon what happens if it's an abnormal amount of pressure. But the way that this is measured is in units of mercury. So mm, meaning millimeters, right? Is that what that, right? Yes, millimeters of mercury. And the Hg is just the chemical abbreviation, or the table of elements abbreviation for what mercury is. That is known as systolic blood pressure and diastolic blood pressure. So when you see there are two numbers, one over the other, that is what that means. One is measuring when the heart contracts, one is measuring when the heart relaxes. And there's a whole nervous system and hormones and a whole bunch of stuff behind the scenes that's helping with adjusting that heart rate, vessel diameter, blood volume, including your kidneys, the renal system as well. So moving forward here, the word hypertension, meaning high blood pressure, is based on the numbers you see in front of you. And it's really important, I think, to understand what these numbers mean if you are at risk or if you are currently managing this condition, so that you have some idea of what a baseline is and what potential future goals could be for you. And I'll talk a little bit more about that as well. Back in the day, 120 over 80 was known as a normal blood pressure stage or blood pressure reading. And then in 2017, the American Heart Association changed their information based on a lot of research. And now the normal stage of blood pressure is actually having those numbers be less than 120 and less than 80. So as you can see here on screen with this chart, you have different stages, and these can go back and forth depending on how you're managing, if you're managing, or if it's an isolated incident like that one on the bottom where you need emergency care because something is going on with your blood pressure. So I'll share a little bit more about this going forward. But The reason why it's so important is because hypertension is one of the most common primary diagnoses that doctors see in America. And they report that about 1 out of 3 people have it. And I'll share with you soon too, it's sometimes unknown. Like you don't know what the symptoms are. You just happen to be feeling a certain way, or you happen to go to the doctor and they measure it and the numbers are off the chart. How this is diagnosed is through a variety of different ways. So there's usually an average of reading taken over multiple times, and then it's confirmed through different what we call diagnostic tests, the way that they diagnose you. So as you see on screen here, and this is why I think it's important too, when you go to the doctor's office and you sit down, we'll talk about this in a second, but when you go to the doctor's office and sit down and they just take your blood pressure right then and there, and it might be high, that's not necessarily indicative of you have high blood pressure. It could just be an isolated incident. So again, it's over the course of a few different readings, a few different visits, and then confirmed through things like this. So ambulatory monitoring is where they'll probably send you home with a little kit and you wear that around your chest and it measures the blood pressure over the course of, maybe a night's sleep or 24 hours. And then they might go into something else like blood tests or urine tests, or sending you to these other kind of cardiograms where you have either a measurement of the electrical system, how fast or how slow the heart is beating, or an echocardiogram where it's measuring the beating heart and it's creating like a digital image of how the blood is moving through the heart and the heart valves. So again, it's not just the one and done. You put a cuff on. Oh boy, I have an abnormal blood pressure reading. It's more about what do they do at the doctor's office? What are they sending you to do to confirm for sure that this is a condition that they're going to diagnose you with. Special considerations I want to bring up because a lot of this is all very related. Anytime you have blood in the body, it's going to be affecting other parts of blood in the body. And so diabetes, blood sugar issues, if you have something with an issue with diabetes or abnormal blood sugar, your goal for your blood pressure discussed with your doctor could actually be a different number. So this is why I want to point this out, that you might not have the 120 over 80 as a goal. You might actually have a less than 130 over less than 80 as a goal. And if you have chronic kidney disease, usually stages 3 through 5, a little bit more serious there, whether or not you're on meds for that too, you also might be given a different goal that's even a little higher than the person with diabetes. So again, this is why it's helpful to know your numbers, what you and your doctor speak about, what the goals are for you, whether or not you're on medicine. And then again, is it multiple readings over a course of a different amount of visits, multiple visits to really get the feedback that you need to figure out what the treatment plan is going to be going forward. Next up, how to take a blood pressure reading. This is, I think, very important too. So if you are curious about having blood pressure readings done at home, you can have a monitor, a cuff, something that you have on your arm or your wrist that you can do at home. You can go to a pharmacy, like a Walgreens, a CVS. They usually have a little blood pressure station that you can go into there. Usually you'll get this done at the doctor's office during your wellness visits or any follow-ups. And ideally, this is how you should be doing it. So when you're at a doctor's office and you're walking into your visit and you're rushing in and maybe you're running late or you're waiting a really long time and you're getting anxious about your visit, this stuff is not being captured here, right? You're probably not working on the same time every day. You might or might not have had some food or drink right before you showed up to the doctor's office. You might be waiting so long that you need to use the restroom and you did not empty your bladder. You might not be seated properly. Sometimes the person who is administering the blood pressure at the doctor's office will tell you, sit straight, don't move, etc. And be quiet. I tend to get chatty when I'm in the doctor's office following up on what's going on. So it's about being as still as possible and making sure you can get that most accurate reading. So if you do this at home, this is the ideal way that you should be doing it. If you're going to the doctor's office and any of this tends to be thrown off, you could either request, can I wait? Can you give me 5 minutes? Can I just, relax myself a little bit? Can we take this again to make sure we have a proper reading? Or you might have to go back under different circumstances where you're able to kind of, set this criteria into place. There is something known as white coat syndrome. I have it. A lot of people have it. It's just the general nervousness that we get sometimes by going to a doctor's office. I joke a lot too, if my blood pressure reading at the office is high, I'll be like, I swear, I love you guys so much. It's not because of you. It's because of me that this is just a situation that happens, that our nerves, right? The blood is boiling, the blood is rising, and that ends up giving us an incorrect reading or a specific reading for that moment. So again, hopefully your doctor or the technician will be taking that again so you can get a more accurate reading for yourself. Now, I mentioned earlier about the fact that unfortunately, there could be no warning signs for hypertension, but there could also be risk factors related. And honestly, it's nothing that you haven't seen before, right? Poor diet. We'll talk a little bit more about that too with food and nutrition in the coming slides. If you're not physically active, for me, that's a big one. I tend to default to not moving around as much as I should, and I've seen that help me with managing my own conditions. Smoking, alcohol consumption, stress is a big one too. We'll talk about that also in the coming slides as well. You could be doing all the quote unquote right things, but if you are actively getting nervous over everything all the time and you don't have a way to manage that, that can put pressure on your blood vessels as well, and that can cause you to end up with high blood pressure. You can also have genetic predisposition to stuff like this. So with any type of condition, what we usually say is there's about a 20% risk factor involved with genetics. So even though it's something as a healthcare provider, I want to know about your family history. If you happen to know that, it helps me understand a little bit more about what we might want to prioritize in our sessions together. But it doesn't necessarily mean this is a guarantee that you're going to have this at the end. Depending on lifestyle modifications or other ways that we can treat the condition, hopefully we can help prevent it or manage it if it does end up happening. So on the right side there, you see the top one is the silent killer. Like I said, sometimes you don't know anything. This is why people sometimes unfortunately have heart attacks and don't even see it coming because the warning signs weren't there. But if you are looking out for things, keep in mind, again, these are patterns of stuff that you see. Each one of these things, I could say, oh, that happened to me once in an isolated incident. But if you're noticing patterns or coincidences that happen, that you're dealing with shortness of breath a lot, with weakness, you're having difficulty speaking or breathing, obviously, then make sure you get a doctor's appointment scheduled so you can either rule out or rule in something that might be a little bit more serious. So let's jump into the strategies because I love talking about what I call the 4 pillars of health. I tend to keep focusing on these things. Anytime we have these webinars, I kind of tend to focus on these 4 particular topics here: nutrition, physical activity, stress management or mental health, and then sleep as well. All very important. And as we like to say, if one pillar falls down, they tend to all fall down. But as you're helping put one pillar up, you help strengthen the foundation, and hopefully the other habits fall in line as well. Because I'm a dietitian, we're going to spend a little more time on nutrition and food. And so we're going to talk here. And if you want to put in the chat, I have a couple of questions for you. No obligation or pressure to do this, just to be interactive and keep you engaged. On average, per week, how often are you eating whole foods? So foods that are in their kind of like natural state, whole foods, things that are maybe what we call minimally processed. So they haven't gone through a lot of chemicals or preservatives, or I should say chemical changes or preservatives or additives. How often, like what's the split, the ratio there in that sense of when you're looking, scaling back over the course of a day, the course of a week? Is it, 75% of the meals are, or 25% of the meals are more of that whole food approach? How often are you eating out versus consuming homemade foods? Not everybody has time or energy or equipment, unfortunately, to be in control of the foods that they eat. So sometimes we do have convenient items depending on what kind of foods you're going out to eat, whether it's a fast food place or a casual restaurant. These are foods that you're not necessarily in control of. We don't really know what's going into something, so that can affect the way that our body reacts to our meals as well. How often are you drinking water? That's another one too. Hydration helps with keeping the body flowing and the cells functioning properly. So if you're being dehydrated, that can affect certain hormone factors, blood sugar levels, blood pressure levels as well. So just think of stuff like that in a sense of, again, on a scale of, what is it on average, 21 to 28 meals every week. If you're having meals and snacks, or, you're eating part 1 and part 2 of certain things, think about what the kind of the balance or the ratio is of those food items. And ideally, this is the recommendations that we have for you. Aim for about at least 5 servings of produce items a day. So I like certain things cooked a certain way, or I like certain things that are raw. So again, depending on the flavors, the textures, the methods that you enjoy, that's what you can focus on. That's not hard to get if you do something like a soup, a stew, a smoothie. You can really cram in a whole bunch of stuff in one bowl, and then you're kind of done for the day. Ideally, we're going to talk a little bit about sodium coming up too. So ideally choose low sodium options and make sure you get savvy with reading labels, because that's where usually the issue is. I'm going to bring this up later too, but most of American sodium intake is from outside foods, packaged goods, restaurants, etc., not necessarily us putting salt on our foods, including potassium-rich foods. So when we use the word potassium and sodium, sodium is something that will be drawing the water into the cells, and potassium helps excrete it. So if you have a high sodium meal, like, you went out for burgers or burritos or pizza or whatever one night, you might notice, oh gosh, I feel really dry mouth and I feel super parched and everything on me is really tight because I'm so bloated. That's sodium doing its job, is pulling the water in. Potassium helps excrete that. Not that you could eat a pizza and then chase it with a banana and be like, canceled, but kind of, it helps with bringing that balance back in. The only caveat I have to make on here is that when you're dealing with potassium-rich foods, if you are diagnosed with a chronic kidney condition, kidney disease does have a correlation, negative correlation with an excess amount or a specific amount of potassium. So again, just make sure you're talking to your doctor or your dietitian before you start saying, oh, well, if a little is good, then a lot is better. It might not really be the case if you are dealing with something like chronic kidney disease. And then, of course, anything that has to do with like whole grains, fibrous foods, these are always really helpful. You've seen this stuff before. It's nothing new, but it's always good to kind of just recheck yourself, especially as we're entering in to this, beginning part of the new year when people are trying to reestablish their habits or recommit to things. Maybe we fall off track by this time, just getting back into the habit of doing that. Next up here of some what I call food swaps. So if you have the ability to do this, if you are creative in the kitchen, like I've been having a lot of fun working with some homemade meals lately, not necessarily cutting out salt entirely, but if you are trying to be mindful of your sodium intake, try other herbs and spices and flavors, acids like lemon juice or vinegars that can really bring up that flavor profile and make things very flavorful and very palatable to eat. So you're enjoying it, and maybe you don't miss the salt as much. Choosing also something like frozen vegetables over canned goods. So canned goods are going to usually be a little bit higher in salt, but you can either open them up and rinse out that brine, that fluid, especially I'm thinking of something like beans or lentils or legumes. Or you can opt to choose, if you're purchasing things in the grocery store, you can opt to choose a low sodium option. The only note I have about that though is if whenever the food manufacturer is going to be removing a particular ingredient that makes things taste good from their food item, they're probably going to add something else to it. So here's where you just need to be a savvy supermarket shopper or ask what's in this. So if salt comes out, are they adding fat, extra fat? Are they adding extra sugar in order for it to taste good? So something else is added. And then, I mean, this is also time, maybe not time saving, but definitely money saving, I think, to buy versus make your own marinades, sauces, and dressings. That's one of my favorite things to do is play around with different flavors. So you usually have a little recipe of an acid, like a vinegar or lemon juice. Maybe you add in different herbs and spices in there, different, again, flavor profiles that you're playing around with. Maybe something soft like, garlic and oregano and lemon, or something a little bit more pungent like cayenne and caraway seeds and paprika. And then you add a little bit of oil drizzled in there, mix it all up, and you have your own homemade dressing that you can stick in the fridge. Let me check in the chat because I see some people chiming in. Oh, that's good. Sadia has everything homemade every day. That's fantastic. You really put a lot of effort and energy into that. Thank you for sharing. And then Far says, yeah, it's part of the culture to cook homemade food every day. That's a thing too. Like in our traditional ways, yes, but when we get kind of like quote unquote more Americanized, or because of the nature of our jobs, our structures of our schedules, all the responsibilities that we have, we might fall off that and it doesn't feel as realistic. But I really encourage you, if you have the time, energy, and the equipment to do so, something really simple like this can go a long way. And then you have the control over that. And then yes, canned beans, wash off and put in your own recipes. Thank you for sharing that. I appreciate that. So next up, I'm going to go through the sodium discussion, and I have some notes on here too because we've done stuff like this before. We had a whole webinar about label reading, so you can always go back and check that out too if you want to check out the library, which I'll share a little bit more about that in a sec. But when we talk about processed foods, we're talking about a spectrum of things. I mentioned before whole foods in its whole form, like I picked something off the tree and I'm eating it, that's a whole food. But processing can also be even the minimal thing, like instead of a whole cob of corn, I've shucked the corn, I've cut the kernels off, and now that is a form of processing. So processed food isn't always a bad thing. It's just based on a spectrum. How far away is it from its original status or way that you can know what's in something versus some of these more heavily added, ingredients like additives and preservatives or added fat and sugar and salt that kind of takes away the nutrient quality to it and makes it a little bit less so. So here are what are known as the salty six. This comes up a lot. I mean, honestly, they all kind of look alike. There's like a grain-based item in here because there's some salt in the flour itself. Cheeses as well can be very salty. Cold cuts for sure. So sandwiches, if you're doing, depending on if you're doing a low sodium one or a like 100% real turkey breast versus a different type of turkey product. So just being conscientious, like I said, with soup or any canned goods, that can range greatly with how much salt they put in there because it has to be shelf stable and it has to taste good as well. And then takeout taco toppings, etc. Again, those sauces and the different kinds of fillings can be quite salty in there too. So the reason why this is important is because the average American takes in more than, I think, 3,400 milligrams a day of sodium, and the recommended is 2,300, unless you are also diagnosed, in which case it's probably even lower to about 1,500 milligrams a day. So anytime you're putting an excess amount of sodium in your body with takeout foods, processed foods, restaurant items, etc., even packaged goods that you have in your house, like bread, right? We're going to use bread for things. But again, it's the patterns of things. How often has this been part of your diet over the course of a day, a meal, a week, etc.? Because that can then be directly correlated to the development of elevated blood pressure, which then increases our health for the risk of heart attack and stroke and chronic kidney disease. And unmanaged hypertension, high blood pressure, can be a risk factor for all of these things because underneath it all, what's happening is the amount of the sodium in your blood system is elevated. That then reduces the ability of our kidneys to be able to excrete what it needs to do to remove the water from our system. Like I said, right, you're holding onto water, you're feeling bloated, dry mouth. That's that water fluids being pulled in. And then because of that, it raises that blood pressure. So that extra fluid creates that strain on the blood pressure. And that can affect your heart, your kidneys, your brain. So all of these things are quite related. And I have a statistic on my notes here too, that even children that we're starting to see now, even children as young as 1 year old up to, in pediatrics terms, up to 18 years old, about 93% of children in America consume too much sodium. So they are also being offered takeouts and different kinds of processed foods that then put them at risk for developing heart disease or related issues at a very much earlier age, right? So think about how you grew up, the things that you ate, what was provided for you. And, of course, I'm always very sensitive to the social determinants of health. Not everybody has access to whole quality, nutritionally dense foods that are affordable. Write your representative, as I always like to say, if that's an issue. But ideally, we want to make sure that people are being brought up so that, especially in those very sensitive, formative life cycle changes that they're going through in a healthy way that can support their body and their blood and their cells. I'm going to share with you a couple of things on screen here that are directly related to specifically sodium, just so we can learn a little bit more about some label reading. Again, this is in a much fuller webinar called the Nutrition Facts Label Reading. And here, we talk about the sodium and potassium. So I just kind of joked, eat a pizza and then eat a banana. It cancels each other out. Not really, but if you happen to look at a label, like you can see here, sodium has, there's in this particular food item, there's 850 milligrams of sodium in this particular food item. But there is a 510 milligrams of potassium. Now, not every label might share potassium on there, but most of them should. That does give you a net amount because it's in that particular food. So as you can see on screen, the calculation that's done, right? 850 minus 510 equals 340. So if you are looking to stay within a particular range, then you can kind of calculate this on your own as you go and know that in this particular case, you have like a net amount that's on there. Next up, so this is in the Nutrition Facts Label webinar, if you were at that, I misspoke. And then in the recording, I had to correct myself and give out different slides. So I just wanted to say it the right way this time. A general good rule of thumb, if you are looking at basic food items, and there's going to be some exceptions, like I think of pickles all the time. Pickles have, like 10 calories, but they might have a ton of sodium because they're swimming around in that salty brine. So this might not apply to that. But if you're looking at things like beans or oatmeal or peanut butter, the general rule of thumb, and I'm going to read this off my notes because I said it the wrong way last time. The rule of thumb is the number next to sodium, so here we have 160, should be no more than 2 times the number Next to calories. Okay, so we're going to do a quick calculation on screen. 230 calories times 2 is 460. So we want to make sure sodium is no more than 460. That's kind of a good kind of ratio, I guess you can call it. A different way to do it, you could also look at that percentage daily value that you see on the right-hand column there, which is 7%. So that's telling you this particular food item provides you with about 7% of your total daily recommended sodium intake. And again, you can see on the bottom there, I've reiterated the max recommended amount is 2,300 milligrams. If you are diagnosed with hypertension, it's probably more like 1,500. Now, what does that mean? Because we're in America and we don't even use the metric system. 1 teaspoon, one rounded teaspoon is 2,300 milligrams of sodium. Okay, technically it's sodium chloride, right? Table salt. But some people use that over the course of a few meals. So here's where you might have to scale back or be careful or limit, some of the salting that you are doing on your own. All right, friends, moving on. So now I give you some examples of food and nutrition. We're going to focus a little bit now on physical activity. You've seen these recommendations before. This is just general guidance across the board, aiming for 150 minutes of movement per week. So that's about 30 minutes a day for 5 days out of the week. You can definitely break it up if you need to. I cannot sometimes be anywhere for 30 minutes straight because I have too much going on. So I'll try to, I'm not sure if you can see it behind me here because I'm in my mom's house and I'm in the guest bedroom, but I have a mat and some dumbbells there. So if I'm on a Zoom call and I don't need to show my face, I might just be marching in place and doing the exercise there for, 30 minutes that I'm on that call. So every little burst counts. And of course, if you have any accessibility, mobility issues that need accommodations, work with your therapists that can teach you how to be able to move around so that that blood and that oxygen gets flowing. And even something like just stretching, right? Getting the body moving, like especially if we're sitting down a lot or driving or our tension is up in our neck and our shoulders, just moving stuff around like that not only creates the physical activity check, but it also helps with the next thing we're going to talk about, which is stress management and mental health support. So things like this are really important because, like I said before, you could be doing all the quote unquote right things with your food, nutrition, your physical activity, but if you're constantly a walking bundle of nerves, like I am a lot of times, that can affect your blood pressure. So it's not like, oh, I wonder what's going on. Why is my blood pressure so high? Well, when's the last time you had a moment to yourself? Or how many things are you doing where you're spreading yourself so thin? Or what are the things that are causing you stress in your life that you need to comment on, you need to put boundaries on. I would love, do we have time? I would love right now. Let's do this right now. I'm going to set a little timer here for about, let's just do 30 seconds, okay? Let's just take some deep breathing or maybe quiet ourselves down and see how that feels. It's going to be crazy. It's going to feel like a year and a half has gone by when it's only 30 seconds. But I'm setting my timer right now and we're just going to do a little breathing together, starting now. 10 seconds left. Okay, that was the alarm. Like I said, for me, that felt like it was a year and a half that just went by. That's all you need. 1 to 2 minutes every few hours. Just take a break, put yourself in a quiet space. This also relates to some of the movement too. If you can incorporate that as well, double bang for your buck there. Maybe you reach out to friends and family. Don't forget to ask for support if you can, if you need it, if you need help for anything, not just organizations and resources, but checking in with loved ones as well. And for sure, this is one of the big things that I did this year. I am off social media for the most part. For the most part, I try to very much limit my screen time. I try to be careful of the high stress things that are coming at me because I am a sensitive person and I take a lot of those things, no pun intended, to heart. Next up here is sleep. If there is one thing that I prioritize all the time, if everything else goes down the pooper, sleep is one of those things that I say is please make this a non-negotiable. This is very, very directly related to so many other health conditions and also will, if you're not keeping an eye on the quality and the quality and the quantity of your sleep can also put you at risk for things like neurodegenerative disorders as well. So we definitely don't want that to happen. So some of the guidance here is aiming for 7 to 9 hours a night. Try as I may, even if I don't put alarms on or wake up at a certain time, my body naturally, I think, wakes up around 6.5 to 7 hours. So I really try to make sure I'm backing into that. So keeping a regular sleep schedule or a routine that you can kind of wind down. And by the way, put this in the chat too. Does anybody have things that they do just to kind of like ease out of the workday, ease out of the daytime, and go into the night and prepare for bed? So if you want, you can add that to the chat while I'm walking through some of my stuff. I definitely have reminders like at 8 o'clock at night, my alarm goes off and I teach. So sometimes my classes don't end until after that. But for the most part, once that 8 o'clock alarm goes off, that means I got to wrap it up. Anything else I'm working on has to be done because I like to be in bed by 9:30. I might not fall asleep until 10:30, but I like to be in bed by 9:30. I like to read. Sometimes I'll watch TV just like for a quick little episode of something that's not super stressful. So, yes, reducing screen time, but putting on kind of like that blue light or that warm light instead of the shocking thing. And if you are noticing, like I said before, when you're thinking about patterns of things, not just isolated incident, but if you're noticing patterns of insomnia or you are not feeling rested, you could have sleep apnea. There could be other issues that are obstructing your sleep. So make sure that you reach out to your healthcare provider to get that checked properly. Thank you. Your cat is your alarm. Exactly. That's great having pets in that. Well, pets and babies can sometimes offset our sleep for sure. For sure. So here I want to just encourage everybody to remember about health screenings. Not everything is always covered by insurance, but usually some of these preventative things like your yearly annual physicals, mammograms, et cetera, and heart preventative things like screenings can really help detect things early, figure out how to get interventions done. And I just say like the more you know. You can opt out of or into things. You have free will for the most part. So, you can definitely just learn information, collect data, and decide on what you want to do with that going forward. And then the more you can put things in order and kind of set up goals for yourself. And if it's not working, you can go back and revisit that with your doctor. So here on screen, we have some life cycle recommendations about when. It really is recommended that heart health screenings should begin as early as 20 years old to establish those baselines and to kind of get those regular checks in place. And then maybe like every 2 to 6 years or so, and as you enter into your 30s and 40s, et cetera, you might have some different comprehensive tests being done. Or as we do venture into our later stages of life, we might have some more conditions being diagnosed. We might have some more complications. We might be put on medicines for different things, and that can put strain on our body too. So you might be more at risk for things. One of my big things I love to share is that one on the 40, 50-year edge there, that first bullet, 10-year risk assessment, the ASCVD, which stands for atherosclerotic cardiovascular disease. It is a screening tool or a risk assessment tool that a doctor uses and it plugs in all the stuff. So this is why if you have high blood pressure, if you have high cholesterol, anything that kind of puts the scare in you, yes, that puts you more at risk, but there could be other things that kind of counteract that. So if you are physically active, if you're a certain age, if you don't drink or smoke, that lowers your risk. So your doctor can plug it in. There's an app for that for real, and then tell you, you know what, your risk factor is only 1%, not 10%, and maybe we don't need to put you on medicine right now. So talk and learn more about things like that. Ask your doctor questions of what this means and what does that do and what happens if I take this and how long do I have to be on things like that. I will say I do have a note on here as well that factors dictating more frequent screenings. So again, anything doing with the vascular system or circulatory system, if you have diagnosed diabetes, high blood pressure, obviously, high cholesterol, or you do have a family history of early heart disease, especially, then you might end up being told to screen earlier than 20, or you might undergo having to go these checkups a little bit more often, maybe sooner in general, and then more often as you go through your life cycle stages. All right. I am a huge fan, as I'm sure you know, of lifestyle habits and modifications to be able to manage any chronic condition. But sometimes the body be doing what it do. So you might be put on medicines. It could be short term, it could be long term. Here are some of the main ones that are given to people with high blood pressure. So you have diuretics, known as water pills. You have these beta blocker, alpha blocker, calcium channel blocker. You have what is known as ACE inhibitors, which are angiotensin converting enzyme. Renin-angiotensin aldosterone is the system in our kidneys that regulates or helps regulate the blood pressure. So again, you're taking medicine to counteract that or to help excrete the fluid, right? The diuretics help, it's a water pill, so it helps excrete that fluid out of your system. Or the last one there, alpha 2 receptor agonist. And I didn't put it on here, but vasodilators too. So I gave some examples of the names of these things like losartan, lisinopril. They have different brand names as well on commercials. You might see them. The 2 points I want to make about this particular slide and medications in general are do not stop or start anything without talking to your doctor, please, because that it can be affected. So you might have to wean off something or wean up something, but you don't want to start or stop anything. if you end up finding you have normal blood pressure, that means the meds are doing their job. So don't stop it because you're like, I'm back to normal. Duh, that's because the medicines are helping. But I will say I'm a huge, huge fan of what's known as informed consent. A lot of people don't read those little inserts in the pharmacy, when they get the bottles, it's like all this fine print. But there really is so much. And my mom, I bring her up all the time. She is one of these examples of having hypertension, being put on a cocktail of meds, never being told anything long term, never being referred to a dietitian, and then ending up with kidney disease later on down the line. Because if you remember from some of our past webinars, medications, pharmaceuticals, drugs, they metabolize or process either through the liver or the kidneys. And since the kidneys are part of our blood pressure regulating system, that's what the medicines are doing there. So it's, kind of counteracting the health of the kidney while also trying to help the health of the blood pressure. So please just be an educated consumer when it comes to things like this. And, dietitians are not infallible. I'm a human. I wanted to share a little bit about my journey with blood pressure over the past handful of years. So I documented this on Instagram a while back that I do have a cuff monitor. And by the way, just a quick note about that. If you have an at-home monitor, bring it to your doctor every so often just to make sure it's calibrated well, like you're not so far off and having wrong numbers at home. Then when you get to the doctor, it's a completely different number or reading. So I was having some issues and I did stick to a pretty decent regimen of really being careful. I was doing a lot of takeout at the time, juggling a bunch of things, wasn't really paying attention to my own intake. Again, right? Do as I say, not as I do type of deal. And then thankfully, especially with increasing some of my physical activity and getting more cardio stuff in, I was able to bring that number down. That's actually a pretty good number. I don't hit that all the time, but I definitely bump up against that, the normal healthy stage. So I'm very happy about how that's working for me. So that is my story. Maybe what's your story? In this particular webinar last month too, I'm going to start doing handouts. So you're going to get a handout that can help you keep track of things and help you build your own personal heart health action plan. So this is kind of just a snippet of what it's going to look like. It'll come when I send the recording out. And it's a 2-pager. You can keep in mind if you want to take or have somebody in your family or life that needs to take their blood pressure. You can also keep track of information, like we said, with the 4 pillars of developing those little micro goals for yourself, like we did in the January wellness reset that we had last month, and creating some accountability, like keeping on track or talking to somebody that can help support you and your health, or you be the person that needs to support someone else if you're related to someone or have someone in your life who's dealing with heart health issues or at risk for that. Here are a list of registered dietitian approved organizations, foundations, and associations that if you want to learn a little bit more or go on here either as a healthcare provider, a patient advocate, or sometimes they have things that are specific to the patient. So like they'll have, diet and nutrition things or recipes and helpful things, or they'll have very, very research heavy things if you are more towards the wellness, health and wellness world. Tenzin, I'm just reading what you said in here. The Japanese eye mask. I can't fall asleep and it puts you right to sleep. Yes, I have what I call my sexy contraption, which is it's a whole headset. There's right, I have like the earbuds in here, the eye mask in here, and there's white noise that goes on, and I am out like a light, my friend. So at the end of these webinars, I always like to say, let's just reflect a little bit on what you learned today. Maybe this is new information, maybe it is not, but it's just giving you a chance to kind of rethink, recommit, refresh some of the goals that you make for yourself or some of the habits you've been doing. What do you want to start doing to help support your heart health? What are you already doing that you want to keep on doing? And then what is no longer serving you? Like for me, I got to really start back up with the physical activity. I keep falling off. It's very important. It helps me I maintain injury issues as well. So I have to do stretching and therapy. So I really have to make sure that that becomes a constant. And what I have to stop doing is stressing out over everything, but that is easier said than done sometimes, my friends. So the next month, registered dietitian's favorite month is National Nutrition Month in March, where we're going to discover the power of nutrition. That will be held on Thursday, March 12th at 12 p.m. Eastern Time. Anybody who's registered for this, you're going to get an email, and the link to register for that one for next month will be on there too. But you know how I work. I post things on the internet, on LinkedIn, on social media. So, and in the newsletters that I send out. So like I said, if I have your email address, you're going to get those newsletters and you can sign up for the next one when we have it. And then if you would just humor me for a couple of minutes here to share with you some of the things that I do on YouTube. So YouTube has become kind of like my library, my dumping ground, but in a good way. I've completely come off of a lot of the other social media platforms, except for just maybe marketing a few, promoting a few of these things that I do. But I really am so proud of how much has amassed in content on the YouTube channel. So if you haven't subscribed yet, please do. It really helps me just drive traffic and get the word out there. There's so many topics. Please share what you can. Like, there's actual conversations when I was doing the podcast the last 5.5 years with other health and wellness professionals or other people that I've met on the great wide internet as strangers and have shared with me their stories. So I really feel like there's a wide variety of topics that are out there. But specific to today's conversation, I actually have a whole 4-part series from when my hair used to be brown that is specific to blood pressure and helping taking off the pressure. So you'll see very specific goal setting things. I think I even have some clickable, downloadable like meal plan templates and stuff if they still exist. If you click on them and they're dead, just email me. But it's a whole 4-part series. Each, as you can see, each of the videos are only about 20 or 30 minutes or so. And there's a lot of really good information. So if you are working on your own heart health, specifically blood pressure, or you know somebody who's dealing with this as a condition, please, feel free to share that with them, leave comments or whatever works for you. And then last but not least here, I always advocate for referring to dietitians. We know what to do to help people when it comes to food and nutrition modifications. And we also take somewhat of a holistic approach too with stress management and sleep and physical activity. So if you are watching this as a healthcare provider, or a provider to be, make sure that you have us on your team. If you're watching this as a patient or somebody who's curious about helping someone in their life with their medical condition, ask questions of the doctor. Why didn't I get referred to a dietitian? Or can I get referred to a dietitian? Or maybe you have health insurance that doesn't require a formal referral, and maybe you could just go ahead and look up something in your directory. I work with a wide variety of patients from across the country. So I do 100% telehealth. I think I work in about 10 different states and, oh gosh, at this point, maybe 6 or 7 different insurance plans. So sometimes they're great and sometimes they're not so great. But at the very least, it's a good thing just to kind of kickstart a conversation that somebody can kind of just get to know a little bit more about their condition. Because a lot of times when they go to doctor's offices, they might not have a lot of time. Unfortunately, those healthcare providers are not trained like registered dietitians are, so they might not be able to provide the information that is very specific or cause more harm, like if they're telling people incorrect things or scary things that we don't want really people to have to go away with having a disordered, relationship with food. And so if it's not me, let it be someone else that's in your healthcare system that you can work with who can help you with that. And as always, props to the scientists and the people out there doing the hard work, research, etc. This is the list of references and resources that I've used to create this particular webinar. And I'm just always so grateful to everybody who works behind the scenes to keep all of this stuff current and available. On that note, with a handful of minutes to spare, questions, comments, or feedback, I'm happy to keep the recording going. No obligation or pressure if you want to stay quiet, or if there's anything again that you've taken away that you want to share, like what you want to commit to, kind of say it loud and proud here so we can talk or support you in some way, shape, or form. If not, I will bid you adieu, and I very much hope to see you again next month as we talk about National Nutrition Month. So thank you everybody for being here. Always appreciate everyone.